There's an expression, and it basically goes that if you don't know you have choices, then you never had a choice. And I want to know what my choices are, particularly when it comes to hormone therapy. I plan to take advantage of those medical opportunities. However, I want to make sure that I'm doing it in the way that I want to.
I'm Annemarie McQueen, journalist and proud 50-ish woman, and we are here looking for the true truth in perimenopause, menopause, midlife, and beyond.
Opening our minds to other possibilities is not always easy.
Pop, I think.
You're all woman to me. All right, Annemarie.
Today, my guest is the globally recognized strategist, Dr. Lydia Kostopoulos. She's based in the UK and has been sought after for her expertise in the intersection of emerging technology, security, and macro trends by the United Nations, US Special Operations, the European Commission, and more. So why am I talking to her about perimenopause? It's because Lydia interviewed me for a series that she decided to do to get herself prepared for perimenopause, and in the process help to prepare others. And I am interested in what she found out from all her interviews and what she's learned and how she feels about perimenopause now. Why don't you explain why you embarked on this, considering it's not really your area? Like, how did this come about, this sort of series within a series about perimenopause?
So first of all, I'm really into human performance. And what that basically means is being able to perform your best no matter what you do. And I was very curious about how other people do it, but I came at it from a healthy aging and longevity perspective because I personally embrace a longevity mindset. And what that is basically understanding that you're going to be living a longer life. Fun statistic, by 2050, the global population of centenarians is going to increase by 8 times. That means that we're going to have quite a few, not just 100-year-olds, but we're going to have a lot of 70-year-olds and 80-year-olds and 90-year-olds. And so when you think about living a longer life, then embracing a longevity mindset helps you inform your choices of what you're doing today for this longer life. So I was quite interested in how other people were doing it. And so I started the Project N of One Healthy Aging interview series. And I basically just asked people, what's your healthy aging protocol? What is it that you do? And it's not asking people in particular who are like experts in a field or an influencer in this field. It's the contrary. It's trying to show the everyday person, because the everyday person has their own philosophy of life. And at the end of the day, anybody could tell you do X 2 times a week, Y 10 times a day, whatever, but it needs to fit your life philosophy and where you're going. So I started doing that series, and I, on the side of that, had already developed a menstrual human performance journal. And this journal is something that I use, that I've developed over the past few years. And I track my menstrual cycle, my symptoms, how I feel. I also do metrics every month around my body composition. And then one day I was like, what's next? What's next eventually is going to be perimenopause. So I started reading a book about it. And then I was thinking, there is no way, we need to have a perimenopause game plan. You can't just waltz into perimenopause. This is hardcore, serious stuff. Your whole body changes, anxiety, aches. It's pretty serious. So after reading Perimenopause Power by Maisie Hill, I wanted to do a subset of my Project N of One series and talk to people about their perimenopause game plan. So it's the same thinking that just as people have their own healthy aging protocol, I want to showcase how different people are approaching perimenopause to encourage different ways of doing things, but also taking initiative. Having health self-determination was the goal. And I have my own perimenopause game plan. My game plan, so I have a national security background. And so all of me is part of this perimenopause game plan. In national security or defense, you have an early warning system for different things, and you have a risk assessment plans for missions and operations and all of that. And so I took that same philosophy into my perimenopause game plan. I'm still many years ahead of it, but I still want to prepare ahead of time. And I think everybody should prepare ahead of time. So for me, it's the first thing is an early warning system. So with my menstrual human cycle performance plan, I look at the data. And so I have a longitudinal data tracking system I can see how my heart rate changes over time, how my body composition is changing. These are key things I want to know for when that happens, not to mention the cycle length and symptoms and all of that, which start to change as you get to that moment in time. And then the risk assessment is really about saying, okay, what's my operation or my mission? It's my life. I want to be able to do the things I like and pursue the interests I want to do. And so then if you take the Army has this risk assessment matrix, and it has catastrophic risk to mission, and then it's critical, moderate, negligible, et cetera. And you can have the same thing for your own life, saying, this is, if it's catastrophic, that means you die. And then so forth. So I leveraged that and incorporated that for me. And my interests, everybody's different, but for me, I like being active. I like going outdoors. I like learning new things. I like traveling. And if you think a little bit about Peter Attia, who wrote his book Outlive, his philosophy is really about the centenarian decathlon. What are the things you want to do when you're 80, 90? Do you want to open a jar? Do you want to pick your grandkid up? Then today you need to be doing X, Y, Z. That kind of mindset. I have done a DNA analysis. I keep track of potentially the risks to me personally, and in general, the risks that all women are going to face when they get to this hormonal change. And then the third part of my perimenopause game plan is the symptoms management. So I'm not in it just yet. And I've learned from your interview and many others about how when you're in the throes of it, you have a plan and then you have to accommodate and change plan and all of that. I recognize that is going to happen. But in the meantime, I can already do research, which I am, to understand what are the most common symptoms and what are the best ways. Because there's an expression, and it basically goes that if you don't know you have choices, then you never had a choice. And I want to know what my choices are, particularly when it comes to HRT, which hormone replacement therapy or hormone therapy. I plan to take advantage of those medical opportunities. However, I want to make sure that I'm doing it in the way that I want to. And so I'm already following a whole bunch of people like Dr. Kasperson and others to understand the different types of estrogen, testosterone, how much, how, like all of these things. I can have self-advocacy when I am in front of a doctor. And even if I find one that's not on board, it's like, okay, great. I'm off. I'm switching. I'm finding another one who is able to handle my choices, my data, and what I want to do with my life.
Has your doctor told you that you're too young for perimenopause? You just don't feel like yourself? You are not alone. Perimenopause can start earlier than you think. That's why Menolabs is here, to support you with a range of products and the information you need to confidently speak up and get the care you deserve. They also offer science-backed products like their bestseller, MenoFit, a probiotic designed to help relieve symptoms like hot flashes and night sweats and more, all while supporting your overall health and wellness. Don't settle for less. Visit Menolabs and get the support you need today. Right now they're offering our Hot Flash Inc. listeners 20% off using code HOTFLASH20 at menolabs.com. Now for the small print, this statement has not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease.
Wow, that is quite something. It's just really neat how you're learning about it now. I wish everyone would. I mean, how old are you?
I'm 40.
You're 40. My dream is like everyone learns about this stuff in their 20s, but at least you're set, you're locked, you're loaded, and you're also super healthy and you're super aware. So you're not going to hit a wall. But when you talk to other people, what sort of takeaways did you have about what was in their plans?
In the Perimenopause Game Plan interview series, I think, so the first common thread is that you don't know what you're going to experience personally. So you can read all you want, you can prepare like me all I want, but there are going to be things that are going to happen to you that you're not going to anticipate. And you're going to have to be open-minded and be emotionally and psychologically resilient. And I think that comes from a place of information and knowledge. And this is why I'm reading so much, because then I won't find myself in a situation where I'm like, oh my gosh, I'm going crazy or whatever. I'll remember, and this is the hope for others to watch that series. They'll see that, oh yeah, they thought they were going crazy. They thought they had anxiety. They had intrusive thoughts. Like, all this is normal. I'm not going crazy. It's the hormonal situation. It's great. Now I need to go get help. That's the idea. And that's the one common thread. The other one was mental and emotional health. And You in particular, you said that you wish you had gotten your emotional health in order ahead of it instead of having to do it during it. And I think the younger generations are more in tune with the fact that mental health is a thing. That's positive. But between knowing that and actually pursuing self-knowledge is a different story altogether. And I am making sure to understand who I am, what it is I like, understanding the boundaries I need to set to take care of myself. I have been learning more about self-care in terms of the many different practices like rest. Rest isn't just sleeping. Rest is having space from a lot of things in life. And I'm trying to develop those new things because that's one of the big takeaways for me. It's okay, mental health. So it's great. Know myself, know how I function, know how I can help myself. I think is going to be one of the hugest assets that I'll have when I go through this journey of hormonal transition.
So you talk to people across disciplines. Like, who did you talk to? Just give us a little sample.
I talked to you, wonderful head of the Hot Flash Inc. And then I spoke with the first person I interviewed. She is a film director, and she definitely embraces the longevity mindset. At age 65, she was an executive and retired. But she then started a new career altogether in filmmaking because that was her dream. So she decided to become a filmmaker. And so she's in her early 70s and making films. And obviously, she's well past perimenopause. However, I thought having a generational perspective on it was really valuable. And she was saying that when she experienced it, which was like 30, 40 years before, she had zero information. So even if you're not like me reading everything, you see it in the headlines. It's like starting to pop up everywhere. But back in her day, there was none of that. And so she had no idea what was happening. And she explained the challenges she faced as an executive doing work and then bleeding on chairs in planes, literally, and having hot flashes in meetings and like all of these things. And the fact that we have more awareness now, I think is good because it'll destigmatize the situation. And so that was one person. Another person is a lady in the UK who comes from Zimbabwe, and she brings an African perspective to perimenopause. She went through it and suffered a lot and wanted other women to not suffer. And one of the things she did is she launched a hotline. It's not a medical hotline. It's an emotional hotline, and it's not a psychological hotline. It's an emotional hotline. So you can call and just scream. Oh. Yeah. And she's just, you call and just say, I'm going crazy. I think I'm going crazy, like just to vent. And that could be the difference between life and death for some women. And it was really nice to hear how she did it. And also, so her perspective was just basically living day to day and being grateful for what she has and hopeful that it's going to pass. And she wanted to do things in a more natural way. So she didn't pursue HRT. And so she shared her experience. And then there was a scientist who specializes in ovarian aging. And I'm a big fan of her work. Her name is Dr. Jennifer Garrison, and she is pioneering research in the field of women's aging. And ovarian health has always been linked to reproductive health. However, that's only one tiny part of the story, but ovarian health is part of women's health, period. And so she's interested in understanding why the body switches over from producing hormones to not producing hormones. And she says that everything that we've got out there, like the HRT and whatever else, that's all a Band-Aid. Your cardiovascular risk goes up, your neurodegenerative risk goes up, all these things go up. And so she shared a little bit about her work, and then she shared her personal perimenopause game plan, which is basically knowing herself, knowing her data, knowing her family history, and being ready for when the time comes for HRT if she plans to take it, and just trying to think about her bone mass and working out. But she recognized that life is busy and you do what you can. So it was really interesting to have these varying perspectives.
And you mentioned that you have decided that you'll take hormone therapy. What information have you relied on to come to that conclusion? Like, I'm assuming that you're saying you're going to take it whether you have symptoms or not. You believe that it has benefits for longevity.
Yes, I personally do. I think everybody needs to decide on their own. So I'm not giving advice to anybody. I'm just sharing what it is I plan to do. So for me, I am into longevity, as I mentioned. I read about all these types of longevity research and books and all of that. The science does show that it can be protective. And so that is what I want. And I want to minimize the adverse impact of this hormonal transition with hormone replacement therapy. I don't know how it's going to look like. From other women, I understand that you don't know what doses you're supposed to have. It's a see how you go situation, and it's not the same throughout. From what I understand, the window is when you're in perimenopause and right after menopause. I don't know what the right year is for me. So what I'm doing is I'm taking as much data as I can, all types of data that I can capture from myself, so that I can have a trend line to show a doctor and have that conversation with more data. Again, I don't know how that'll work. I'm still away from that moment, but I'm preparing data wise to be able to say, here, what do you think? How should we start? And then I'm following, for example, Dr. Kasperson, who talks a lot about testosterone. She's a urologist, and she is talking more also about intimate wellness, which is something I think that a lot of people don't talk about, or it doesn't get as many headlines as the rest of the hormone piece. And so she comes from it from a urologist perspective, and she says that vaginal estrogen is very helpful, but then also it's also helpful for intimate wellness as well. So all these things are things that I want the full deluxe package. I want to get to 70 and 80 in as best condition as possible. And that is my perspective of how I think I can get there based on what I have been reading.
And in all these conversations, like, I always worry that we're passing on this just, oh my God, this horrible transition that you have to prepare for. How did you feel? Did it make you feel hopeful, scared? Do you feel better or worse after you started this?
So hearing all these women, I'm like, oh my gosh, I need to be ready. I need to be ready. But seeing everyone come out on the other side is very inspiring. And seeing women live their life in their own way is, to me, the biggest kind of goal. That's what I want to do. I want to be able to pursue the things I like. And so just seeing women get through menopause, come out on the other end, and just live the life that they want, that's what I want. And that inspires me. And there's obviously many roads to that destination. Some include hormone therapy, some don't. All of them are inspiring to me. That's another thing I want to show others. Like, here's details of how women have gone through it, and here are the things they do with their life. Like, it's not a crippled mess.
Yeah, it's not like you just head into a tunnel and never come out. It's like
Exactly.
I feel sometimes that gets lost in the conversation. And having gone through it, I'm so happy to hear you say that, because I marvel all the time and I feel like saying, but I feel so good compared to the rest. Because I think there's a lot of noise when you're younger in your mind, and that maybe you don't even realize is there. And then when you get into your 50s, it's a more peaceful sort of situation anyway. It has been for me. So I'm super glad to hear you say that, because I was going to say, Lydia, I hope you're not like upset after the whole thing. You would be like just left depressed and just not wanting to get any older. That would be no good.
No, but it's definitely something to take very seriously.
Yeah.
Particularly people who have jobs. You need to make a living. You have things you want to do. You want to make sure that you can get through that period without your life collapsing. And for some people who have not had the many forms of support, it has been that way, and it shouldn't be that way. So again, that's my hope with the perimenopause game plan, is to show there's different ways to get through it, and it's possible. It's fine. It doesn't have to be horrible. And we need to keep seeing more women like you living their best life to remind us.
A lot is in your hands, and you're living your best life too already. And tell me about your compassion buddy, AI compassion buddy. It was in your bio.
Yeah, I'm really into healthy aging. And I feel as we're looking at longer and longer lives, we're going to have compassion for the way that our body won't perform the same way that it used to. Because I'm reading about like what it's like post 70. And yeah, sometimes friends go away and just things change quite a bit. And ageism is also real, and we need to work hard to combat that and create a new kind of way of being 80 and 90 and being part of society. But separately from that, mental health is a very important thing for healthy aging. And given the way the world is right now, with a lot of conflict, climate anxiety, etc., I think that we all could use a little bit of self-compassion and self-kindness. So with that in mind, I created a AI compassion coach, and you can find it on the GPT store, the OpenAI GPT store. It's called Compassion Coach, and it's by me, Lydia Kostopoulos. You'll see it with the name there. And basically, you can just talk to it, and I think that could help ease and validate people's feelings and struggles, no matter how small or how big they are. And anyway, my hope is to help people find a compassion perspective through the Compassion Coach.
It's really neat to hear that you're doing that. I'm going to look it up. And it's neat to meet someone who's so multi-passionate. It's really cool. And I just wanted to thank you for coming. I wanted you to thank you for doing that, but I also, and talking to me, but also just for coming on here and talking about it. I really appreciate it.
No, I love what you're doing. It's a pleasure.
Hot Flash Inc. was created and is hosted by Annemarie McQueen, produced and edited by Sonia Mack. The information contained in this podcast is intended for informational purposes only and is not intended for the purpose of diagnosing, treating, curing, or preventing any disease. Before using any products referenced on the podcast, consult with your healthcare provider, read all labels, and heed all directions and cautions that accompany the products. Information received through the podcast should not be used in place of a consultation or advice from a healthcare provider. If you suspect you have a medical problem, i.e. menopause or anything else, or any healthcare questions, please promptly see your healthcare provider. This podcast, including Annemarie McQueen and any producers or editors, disclaim any responsibility from any possible adverse effects from the use of any information contained herein. Opinions of guests on this podcast are their own, and the podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about a guest's qualifications or credibility. This podcast may contain paid endorsements and advertisements for products or services. Individuals on this podcast may have direct or indirect financial interest in products or services referred to herein. This podcast is owned by Hot Flash Inc. Media.